Okay. Inanimate vein is the answer that 30% of you gave. Some think it's aortic dissection, some think it's a patent ductus arteriosus, and some think it's aortic rupture. Okay, let me show you this loop again, and I'll walk you through this, and then I'll show you what the correct answer is, because this is kind of a little bit of a teaching case. Here you see, again, the aortic arch, and one thing you notice right away is that there is widening of the aortic arch. So this, for sure, is, I would say, an aneurysm, actually, of the aortic, the ascending aorta and the aortic arch. And then you have this flow here, and it's a continuous flow. But it's very difficult to really say where the flow is going to. Does it really enter the vessel? It's going downwards, obviously, and it's turbulent, and it's systolic and diastolic. But the question is, where is this flow coming from? And there's kind of a structure right here, or a vessel, maybe, and then there's kind of a membrane. So what you can do is you can simply do the following. You can inject contrast, okay? And this is just what we did. We took contrast, normal contrast. Now, we don't need necessarily to give any other contrast than those that you would usually give to detect the PFO for a certain reason. Now, this is the reason why we injected a venous form of contrast into the arm vein, and you see that here, right here, you have flow, and the flow is not entering the aortic arch, which means it does not have connection to the arterial system. It's just a venous flow. And if you now go back to anatomy and look exactly what this could be, then you will realize that what you simply have here is the left subclavian vein. Look here, this is the aortic arch, right? And the subclavian vein is right on top of the aortic arch. And since this patient had an aneurysm of the aortic arch, there's some form of compression of this subclavian vein. And if you inject it, the contrast, obviously, into the left arm, then you will see increased flow or kind of turbulent flow where the obstruction of the subclavian vein is. And it just looks as if it's dissection, but you do have just the wall of the aortic arch and the wall of the subclavian vein that separates the two. So certainly this is not really a pathology, but it's something that obviously can cause to confusions and to maybe a false diagnosis. So this